small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES. With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back with an interesting study. There was a study just published this week, and it was written up in ASCO Post by Joan Cavello, and it looks at NSAIDs like aspirin and Advil. Now, can you think that aspirin and Advil would have an effect on breast cancer? The answer is yeah. And the study looks at women, obese women and overweight women with breast cancer. It's suspected they have elevated levels of inflammation, including greater COX-2 expression. Overweight and obese women who regularly used aspirin or COX-2 inhibitors like Advil and Motrin and Aleve had a 52% lower recurrence rate of breast cancer. Wow. So again, this is a study, randomized study from Texas and from Sweden, started in 1987 and looked at women who are overweight or obese. They found that the recurrence rate in women who used aspirin and nonsteroidal anti-inflammatories was 52% lower than in women who did not use aspirin and anti-inflammatories, nonsteroidal anti-inflammatories. The recurrence time was longer, survival was better. Wow. So think about that. Women with breast cancer, improved survival, less mortality, taking aspirin and nonsteroidals. And another study, and I know it's very controversial, men are being whiplashed by getting checked for prostate, not getting checked, the recommendations are here and there and back and forth. Where's a randomized study? So a randomized study in medicine is the ultimate. It means that you could take a group of people, half get one thing, half get the other, and then you follow them with time. Well, this was a study published by Schroeder in The Lancet, which is a very prestigious medical journal, and it looked at men aged 55 to 69, and men who were screened had a 21% decreased risk of prostate cancer death and an absolute increase in benefit at 9 years, 13 years, and now more years. So they matched the patients. They matched men 50 to 74 years old from populations in 8 European countries: Netherlands, Belgium, Sweden, Finland, Italy, Spain, Switzerland, France, and they were randomly allocated to PSA screening or not, and they were screened. The interval was 4 years, except in Sweden 2 years. And what happened? Well, there was a 21% reduction in breast cancer death in people who were screened. So men who have questions about it, now you can say, okay, it's maybe not cost effective for your insurance company, or maybe certain men have to get biopsies, or the inconvenience of blood tests. And the question is, what do you want? Do you want the convenience of no one seeing you, seeing no doctor, or do you want the convenience of a 21% reduction in death from prostate cancer? So it's your choice. The data is there, and the data is pretty persuasive. So take a look at it. It's in last week's Lancet if you want, or we can come in and speak about it and speak about you and your situation. You're always welcome to give us a call. Best is to come in. And we had a man with a totally unrelated disease, a melanoma. So melanoma is often considered a sun-exposed skin cancer. It's considered one of the most dangerous. This man is a 69-year-old financial consultant. He has 2 kids. He was diagnosed with melanoma on the cheek in 2002. He was treated by a dermatologist and had a repeat excision. In 2006, he was being checked for a postnasal drip, something totally unrelated. No one was following from melanoma, believe it or not. And the pulmonologist found that the cancer traveled to the mediastinum. The mediastinum is a part of the body between the right lung and the left lung. It's where the heart sits, where the blood vessels are, the major blood vessels, and airway and nerves. He had a biopsy, and it showed melanoma. He started on interleukin, which is a kind of immunologic therapy, and he just couldn't tolerate it. His kidneys went into kidney failure. His creatinine went up from 1 to 4. It never went back to normal. It's now 1.5, and this is years later, from 2006, 8 years later. Then he started immunotherapy. He's been on for 5 years at a big cancer hospital, and the doctors there kept on telling him everything's working, everything's working. Well, he never saw the paperwork, and that's why I keep on badgering you. Look at the papers. You can get the papers. You can read. If you don't read and understand everything, ask questions, but you can read, get the papers. Well, his doctors never showed him the papers of his cancer. They told him everything is fine, and now this year, a friend of his is a urologist, his best friend, who knows me, said, why don't you go see Lederman? So we called up Lederman, and he came in the next day, and I saw him, and we went over the paperwork, and we called the radiologist there at the cancer place. And in fact, this cancer had gone from 5.6 centimeters in 2008 to 8.3 in 2011 to 9.3 in 2013 to 13, and he kept getting the same treatment. Well, it doesn't take a genius to tell you that if it goes from 5.6 to 13 centimeters, actually in volume, it's increasing by about 80%. Huge change in volume. Well, if a cancer is growing by 80%, it means that it's not working. It's just not working. It's actually not more than 80%. It's 8 times. It's 800%. It's 8 times because it's the third power of the radius. A volume is proportional to the third power of the radius. So the radius before was 2.5, so it'd take 2.5 times 2.5 times 2.5, and now it's 14, so take 7 times 7 times 7. And you can see how it's growing incredibly. It's wrapped around the trachea and the lungs and the major structures of his chest. Wow. And he's been told all this time that it's unchanged? Wow. So he's really fed up and angry. You can imagine going every month for 6 years, being told it's the same, and find out that it's been growing all along. So he's choosing radiosurgery. His cancer is 1 liter in size. He has 1 liter of cancer in the chest. We're going to do radiosurgery, 5 treatments. He's starting this week. We wish him well, and we'll report back to you on his progress. We want to see the cancer shrink. And in general, for melanoma, and other skin cancers, our success in stopping or shrinking the cancer where we attack is about 90%. So most likely he's going to be okay. Luckily, it's only one spot. You can argue, wow, he's had this cancer since 2002, but it's only been in one spot. So thank God it's only in one spot, and we're grateful for that. And changing topic again, I would like to talk about this gentleman who had prostate cancer, 65 years old, lives in Manhattan. His PSA was 11, and he came in to see us for a second opinion. He was offered a biopsy at a city hospital, and they wanted to make him wait months, and we arranged for him to get it done immediately, and found that he had a Gleason 7 cancer. So for him, PSA 11, Gleason 7. With us, the vast majority chances he's going to be cancer-free. How do we monitor it? Well, we'll be following his PSA, his physical exam. He's starting treatment. Also with us, compared to most radiation centers, the treatment will take half the time, yet it will be more intensive because we often use brachytherapy. Brachytherapy allows us to put radiation seeds through the skin, not the penis, not the scrotum, not the anus, not the rectum. Through the skin, we use anesthesia so people feel nothing. It takes about 45 minutes, but it allows us to boost the dose. So brachytherapy, brachy is Latin for meaning close to the cancer. So the seeds are actually very close to the cancer, so it gives a maximum dose, and we know that higher dose leads to better success. So we wish him well, and again, we'll be reporting to him, hopefully in the good news section of our program. And another man with prostate cancer. Now, this man had prostatectomy at a hospital in one of the 5 boroughs. He's 66 years old. He had a PSA of 3.97 and Gleason 6, and he had radical surgery in 2005. And his PSA isn't at 0, so it means that there's cancer cells left behind. So we talked about that a little bit earlier in the program. His PSA is still in the 0 range, but unfortunately it's 0 point something and not 0.0. It should be 0.0 after radical prostatectomy. And there are studies, many studies, to show that if you use radiation after prostatectomy, you get better results than prostatectomy alone. Now, we don't advocate that as the best treatment, but it's the best treatment in his situation. Since he already had the radical prostatectomy, he chose that before he came to us and perhaps before he knew the data. So we're trying with every patient to do the best we can with their particular situation. We're going to stop now. We're going to hear a few voices about our work, and then we'll be right back to take your questions and talk more about what's up.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan